Bismillah ar-Rahman ar-Rahim. Desquamative interstitial pneumonia, DIP. The definition of DIP, it is ILD, interstitial lung disease that occurs in smokers and is associated with the pathological finding of abundant pigmented macrophages located diffusely throughout the alveolar air spaces. It may represent a more extensive form of respiratory bronchiolitis associated interstitial lung disease, in which macrophages are restricted to peribronchial regions. The term DIP is misleading as the squamation of epithelial cells is not responsible for the histological findings, as previously throughout a more accurate term in alveolar macrophage pneumonia, although this is not in widespread use. Epidemiology, very rare. Majority of patients are smoker, although may also occur following inhalation of inorganic dusts, including passive inhalation of cigarette smoke, typically occurs at age of 30 to 50 years. Clinical pictures of desquamative interstitial pneumonia include the following. The onset of breathlessness and cough over weeks to months is typical. Clubbing is present in up to 50% of patients. Investigations include pulmonary function tests, which reveal mild restrictive pattern and sometimes with reduced gas transfer. The chest X-ray may be normal or may demonstrate reticular or ground glass pattern, particularly affecting lower zones. HRST, ground glass seen in all cases, typically lower zone or peripheral predominance. Reticulations in the honeycombing may be present, although tend to be mild. Bronchoalveolar lavage, increasing pigmented, there is increase in pigmented macrophages, and the histology, diffuse accumulation of pigmented macrophages in alveolar airspace. Again, diffuse accumulation of pigmented macrophages in alveolar air spaces, and changes are uniform. The diagnosis of DIP, clinical and HRST features are non-specific, and surgical, like biopsy, is often required for the diagnosis. The management, smoking cessation, and corticosteroids are often used. Smoking cessation, the mainstay management, and corticosteroids are often used with high response rates reported in retrospective cohorts studies. Prognosis, usually good prognosis, improvement in ground glass on HRCT may correlate with response to treatment. Survival is 70% after 10 years. Fluctuating courses with reemergence and relapse may occur. That's all about desquamative interstitial pneumonia. Thank